Welcome to Dental Unscripted, where Mike Dinsio and Paula Quinn break down the practice ownership journey, one episode at a time. Starting up, buying, and running a successful dental practice.
All right. Hey guys, welcome back to another episode of Dental Unscripted. As you all know, my name is Michael Dinsio, and I also have my co-pilot, Paula Quinn. She is here helping me beat up every vendor and professional in the industry. No, I'm joking. We're totally joking. There's no beating up. This is just great, good old information, and we love doing this. Some housekeeping real quick. If you're watching or listening to this program on Acquisition Unscripted or Startup Unscripted, please jump over to Dental Unscripted. We're managing these programs and trying to keep it to one program. There's still a lot of you following those other podcasts, and we'd like for you to jump over to Dental Unscripted. So please follow and subscribe that one. But without further ado, let's just jump right into it. I'm excited because I get to interview a mentor and friend that I've known forever. I know when I first got into Bank of America, Phil showed me the ropes. That's how far back this relationship goes. I even followed him into some other things. And this guy's a smart dude who's been doing it way longer than me. And so I'm excited to learn from him today. So without further ado, I'm gonna introduce Phil Hoover with Western Practice Sales. What's up, Phil? How you doing, buddy?
Doing well, Mike, and I haven't done it way longer than you. A little bit longer, my friend.
Well, your knowledge feels like it's way longer, but
I appreciate that.
It's a pleasure having you on a program. It's stupid that you haven't done this yet. I've had a lot of our old friends and partners that have gone into different directions in their career, from B of A to whatever else. And here you are, one of the owners and partners over at Western Practice. We interviewed Tim, 3-4 years ago. That was a great episode during Shark Week. And Tim represented well as a shark for the Acquisition Unscripted Shark Week. But today we're going to break down LOIs, as I feel like it's a good topic to cover because there's a lot of questions around what's the process, what's the timing of it, what does it mean, is it binding, what players need to be in place, how do I make these decisions? And of course, I could have had the program with Paula, as she's gone through the process a couple times herself. So Paula's on the show to bring us some, more boots on ground experience. But I also wanted the other side, which is the seller side. So you got a buyer's agent, someone that's gone through this, and a seller's agent. So we got a nice panel to discuss LOIs. But real quick, Phil, who are you, and what's Western Practice Sales? Real quick.
Thanks, Mike. Thanks for having me on. Phil Hoover. I've been in the dental industry for 20 years, a little bit longer, actually. I've been in banking and finance for the majority of that. I had the opportunity to work with Tim in the last few years and take over the Western Practice Sales arm here. And we are a dental broker based out of Northern California, myself, and we have 4 other brokers on our team. And we service Northern California and really all of California. And, we are one of the largest, if not the largest brokerage here in Northern California. So a lot of experience on my table, on my team. A few of my brokers have been in the business for 40 some years. Myself and my partner, we have 3 ex-dentists on staff, along with myself, that's been in the industry for 20 years plus. And, we're excited to keep growing, keep going.
Yeah. And your transaction numbers are insane. You guys process and transition a lot of practices. So you see the good, the bad, the ugly. And I think today we can touch on some of the ugly, right? Like, I think we should all learn from some of the things that don't go super well. We can celebrate the ones that are just smooth sailing. And so with the topic of LOI, Phil, like, in your mind, how important is an LOI to the whole entire process? because it sets the tone for the entire process, and it's a very scary thing for both sides, seller and buyer. It's scary for both. And I think the LOI sets the entire tone. Do you agree? And what's your take on just the LOI in general?
Yeah, there's benefits to both sides when an LOI is brought to the table. We're talking at that point in time, we're talking about the transition. We're talking about the exit strategy with the seller and the entry strategy with the buyer. And it's really when the rubber hits the road, and it shows that there's commitment from both sides of the fence, right? And when we get to the point where there's enough information on the table where a buyer can make an educated decision on the next steps, that says that myself and my seller have done a good job of relaying information, relaying data to the market that shows that our valuation is proper, correct, and it shows that the buying community is recognizing what we're selling and holds it valuable. So, in that response, initially just having an LOI and having the conversation about it just really sets the stage for what's about to happen next. And that is trying to set up a smooth transition for the buyer and seller to build a relationship to get to the closing table and the transition at the end. And without good communication on the front end, starting with due diligence into the LOI, it can get rocky. And there's some, hurdles that need to be explored when we're entering into that LOI stage.
Yeah. Yeah. I mean, Paula, like from a buyer's perspective, do you remember making your offer? How did you feel going into that situation? I think that'll key up a really important discussion point, because Phil, you talk to the sellers and you know exactly how they feel into that process. Paula's the buyer. It's extra. It's probably extra for Paula because she's a hygienist, so there's a little extra stress on a non-dental owner. But how did you feel going into an LOI, and how did you? Do you remember like any main things about that?
Yeah, I think you feel like it all needs to be ironed out before you submit that, because you're afraid it's so binding, like you're stuck, and then you haven't seen under the hood, and you don't know all the stuff except what's in the prospectus. So it's scary because you feel like, well, what if I get in there and this isn't right, or this isn't right, or they're lying about this, and then how do I get out of this? So it is pretty scary. Now that I've been through it, which I'm sure is what Phil will talk about, there's still time, and but it doesn't feel like that when you feel like you're like, this is your last ditch effort to get all of that. How are the accounts receivable being handled? How is this?
So many questions. Yeah.
Yeah. So yeah, I remember it being scary, and I felt like I was doing something that I really didn't know for sure.
Yeah.
You know,
Yeah.
what it was going to turn out to be. So it was nerve wracking.
And
It's almost like, like buying a house, I guess, is different, but it's like you're committing before
mm-hmm. Yeah.
what it feels like.
And then from the seller's perspective, Phil, like, what's it mean to them, and what's it feel like to them? Because I think I know what you're going to say, but when you have your conversations with sellers about LOI, and they're going through that process, and you're trying to coach them through that process, where's their head at?
It's over. Let's do it. Good. Let's go. The reality of it is it's just beginning, and that's where the conversation with me and my coaching to the seller on the front end, it's not over. We are going to look at the nuts and bolts of the deal, nuts and bolts of the practice, and it might get uncomfortable. And I preface all of our sellers that there's going to be some tough conversations ahead, and rightfully so. A young doctor is going to put their career and a lot of money on the line in order to make this happen. So, expect that to happen. That seller's relief, though, Mike, I tell you, it's they are ecstatic. And I think the buyer feels
because they got an offer, or because they got an offer. or
because they're ready to go. They're ready. Ththey're
it
ready
goes both
yesterday to get the
ways.
hell out of.
hey Phil, did we lose you, buddy?
A little bit.
Yeah, I think it's. I think where he's going with that is that, like, to your point, Paul, it's like they think it's already over. They're excited they got an offer, but the journey of it is just gonna be a really long episode or journey. I it's interesting when practice brokers come back, like,
You
when
back, Phil?
did you come back, Phil? No.
Oh, there he is. I see him moving.
I know it's every once in a while. Yeah.
Okay.
I was just kind of taking that to, if you don't have any professionals involved, it's hard to manage buyers and sellers' expectations without professionals. You know what I mean? Like, I know that buyers are so emotional about this that they do need help, whether it's a CPA or maybe a friend or colleague helping them through that journey. The seller needs that just as much as the buyer. I think we've got you, Phil. You can pop in and finish your comment there.
No, maybe. Oh, there he is, Phil.
Yeah, he's losing it.
Why don't we ping him to leave, and then, yeah, I mean, I would say, I think the biggest difference for me being a buyer and a seller, because eventually I was a seller, I would say was, like, I feel like I got a great product here.
Like,
this is
because you own the practice and it's your baby.
Now I own it. It's my blood, sweat, and tears that have gone into it.
Don't call my baby ugly.
Yeah, I mean, this is my baby now. Like, before I was about to, buy somebody's baby. Now someone's buying my baby, and my baby's perfect. You know what I mean?
Yeah.
So then it's like an insult when someone's like, well, what about this? And what about this? Where as a buyer, I was doing the same thing.
Yeah.
You know what I mean?
Yeah.
Are you back, Phil?
I missed a lot of that, but I think I know where you were going. I apologize for that.
Well, Paula just jumped in as a seller, and
yeah. So I think Michael, what you asked him something about,
well, just
like,
just that they're excited to get an offer and the value of it, and they're ready for it to be done. And here's the buyer thinking that their life is about to be imploded because they're not sure what they got into, which is why professionals are so important to be part of this process.
Right. And I think the key to that moment in time is to capitalize on the positive energy from both parties. And I think that's where we really need to, as professionals, work together to build on that positive energy instead of saying, okay, what's next? And saying, let's dig deeper and pick you apart. It's more of, okay, let's come together, work together to find out maybe some of these holes, because everyone knows they're there and we're going to find them. So let's just work together to put them all on the table and get to the finish line, and get to the finish line holding hands and not driving a wedge between us. And that's the one thing that I think we're seeing in today's market, Mike and Paula, is, once that letter of intent is executed and brought to the table, defenses start going up. And we got to just watch that. We got to watch our delivery at that point in time.
I think that's beautiful. I think that's exactly right. We keep coming back to this idea of binding, non-binding. The truth is it's non-binding, but there is a good faith element to it. And we wanted to touch on that. So it's non-binding legally. You can get out. If you want to get out on both sides. But there is this, like, good faith thing. And Phil, I'd love to ask you this question from a good faith / non-binding. They're kind of one thing. If you think about it, there's a good faith that you're moving forward, but at the same time you can get out. So what are your thoughts about that?
I have your contract right in front of me. I have mine on the computer here, Michael, and they're both very simple. If you want to get out, you get out. It's done. That's it.
Yeah.
The reality of it is that the seller's expectations at the time that a letter of intent is executed, they feel that the deal is done. And at that point, we want to take the practice off the market and spend our time with that buyer and to find a way to, in good faith, come to the finish line. So we are willing to use all of our efforts in order to complete the transaction with the one individual that we have in place to buy that has the letter of intent. Now, you had mentioned, and we have talked about before, there are other opportunities when there's multiple offers. And that's when, we need to absolutely discuss, the buyer's expectations and their reality of getting to the finish line. And that's where you and the professional team on the buyer side, that communication line is so important to understand where we're going in the next, if we accept your offer, where are we at? And I think that's very important.
Yeah, I do too. I think like what we didn't cover, because I don't want to take this down due diligence episode. I want to stay right here with the LOI. I think what we didn't cover was what's the appropriate amount of information for a buyer to get to make this scary decision, Paula, scary decision, because you want to know everything. You want to know the membership plan details. You want to know what the fee schedules are. You want to understand all this stuff because you feel like once I sign this, I'm locked. And then the seller is already making vacation plans just because they got an offer. So it's like these two extremes, which is really funny. But like what, I think there is a science, and well, I know there's a science to valuation. I do it every day, and Phil does it every day. But in your mind, Phil, why do you think some information up front makes sense and more detail later makes sense? Not all of it right in the beginning.
Terms of
give a broker's dentistry perspective,
the dentist is going to do the dentistry. So the focus prior to LOI is, can I do the dentistry? And that's where the focus should be. That should be on practice analysis reports. That should be on production analysis reports, and looking at if the doctor is able to handle the dental work, if there's any specialty work that's being done, anything that's out of their comfort zone, and how they would, address that going forward, or if it even needs to be addresses. And then the add-ons of looking at, maybe I can imply some ortho or perio or some other opportunity on the front end. And that all comes from analysis reports. Then on the back, and while that same is still going, you need to look at the basic financials, the P&Ls and tax returns. And I think 2 years of P&Ls and tax returns is more than enough to understand the cash flow and the revenue stream and all the details that it takes to make sure that the practice works for you financially. So, it can be very basic. And then, of course, you need the pro forma prospectus. It gives a lay of the land in terms of equipment and that detail and the lease detail. But the key component is, can the dentist do the dentistry? And is there opportunity to continue that success going forward? That's where I would hang my hat on.
Yeah, I think that's right. I even on the buyer side, and then I'll throw it over to Paula too if she's got any objections to that. But I agree. I think to make an offer, you need to know what the historicals are as far as how much money I can expect to make, and that should be pretty clear. I should know what that is. In my mind, it's, hey, this is what you made. If I did everything you did, that's what I'll make. Now, of course, there's different situations with shell purchases or, practices that didn't perform super well. And then all of a sudden assets become part of that. But we're talking about hitting it right down the fairway, dental practices, bread and butter practice, doing 800, throwing off a decent amount of income. You should be able to know exactly how much that business makes. And you should be able to tell if you can do that dentistry, to Phil's point. So that is really it. At that point, it's really about where I'm going to struggle and what holes, like Phil said, what holes are there that I need to fill to make it better. But I mean, Paula, you talk, that's it. I think you can come up with a very good value and make a solid offer based on that. Paula, you look at lots of practices with me on the back end during the due diligence. Oftentimes you're not part of that valuation process, but I mean, I can't think of too many offices that we've helped where we found some explosion of different information that blew up the deal. Maybe it happened once, twice, but right. I mean, it's usually about what the doctor
No,
can do.
I actually even look at their gaps as opportunity for the new doc. You know, it to me, it's always like, this is good news. They do one crown every month, and then we can, we get to do one daily. You know what I mean? So it's, my red flags are, like Phil said, can you do the dentistry, and maybe is the dentistry all done? There are full mouth reconstruction doctors out there that's not saying there's not dentistry, because we're all getting new patients, and you can pivot the practice. So even that's not a immediate no, but it's those are probably the scary ones, right? If there's lots of procedures, or a big part of the practice that's doing something you can't do, or if maybe it's like you're a little worried that all the dentistry could be almost done.
Mm-hmm.
It's not going to be on a bread and butter doctor ever, but a full mouth reconstruction doctor, you might have that worrisome. But I think all the other things are doable if you know. And I like the way Phil just put it, because for me, he's right. That stuff, I just want to know. It's not going to make or break me buying the practice. It's just, I need to know that stuff. I don't want to come in day one and no one told me there was a membership and I'm doing free cleanings left and right. That's the stuff that sucks. And we had a brief conversation right before we went live, and I got into the due diligence before I realized it was all LOI. And that's the stuff I was talking about to Phil. But no, I 100% agree. It's the profitability, and then can you do the dentistry? And let's go. I can figure out the rest. It could be a team thing. It could be a system thing. It could be hey, it's all opportunity.
I would like to kick this over to Phil if he's got still good connection here on.
Do you, Phil?
Yeah. He smiled. It's perfect.
Okay.
When you're a broker and you get one buyer that wants the whole due diligence package up front before they make an offer.
Oh, I want to say something about that. I'm going to make a note.
And then another buyer who's just kind of like, you send the prospectus over and they know how much they're going to make, and they've spent the time looking at the production reports, and they're like, yep, I can do this. What's that like for the broker? Because the seller, they're not thinking anything. They're thinking, well, they're not being picky choosy, but to a broker, your whole job is to be picky choosy. So walk us through kind of like that psychology or whatever.
Money is money and people are people, right? And when you present a case to the doctor, most of the time, money over character wins. And the money is typically not a big differential between 10 or 20 grand is not going to make a difference. Maybe $100,000 convinces somebody. And that's the people that are throwing it and they're going to look the other way, give me the practice and get out of the way. That is still out there. That still exists, right? When you have that practice that's in a desirable location and you do talk to 8 or 10 convinced buyers that they want to take it to the next stage and they want to put a letter of intent in, we're collecting resumes and we're having interviews with the seller. And then it's about character. It's about who's going to fit that practice the best. And, that's a great problem to have, right? And you know what? We might not bat 1,000 when it comes down to that, because everything, maybe there's something unforeseen that we don't know, buyer or seller. But, Michael, I think character in these doctors and these sellers' eyes, once that sizzle of, oh, good, I got an offer, I'm going to go to Hawaii next week and retire. Once that sizzle kind of fades away after a week, then they realize, man, this is still a lot of work. I gotta coach this buyer. I gotta coach you, Phil, and coach you, Mike, to get this thing to the next level and the next phase so I can retire. And, it does make a difference. And that's the information we try to relay to our sellers is like, we got to pay attention to who we're accepting the offer from too, Mike. And sometimes it's not all about the money.
Mm-hmm. Paula, you had a question or a comment that you wrote down.
Well, yeah, it was a comment. It's a little ways back, but and I'm just going to throw that out as a perspective. You guys are calling this, you had it up there, LOI in good faith, or however you had that.
Mm-hmm.
And I would say, have you ever taken into consideration, both of you, because you're representing the seller and the buyer, like good faith to me is different than what's good faith to maybe Michael. And when I'm going into an LOI, or when I was going to my LOI, I should say, I'm also feel like I am putting my good faith on the line. I'm telling this doctor, hey seller, I'm ready to buy, and I'm in 99% unless something crazy happens. So maybe that's why some people are a little more detailed up front, because my word is my word. And if I'm giving you my word, and then I get in there and there's like this and that, and it may not be the dentistry thing, and it may not be a productivity thing, but it's just a lot of
Stuff.
garbage. I mean, maybe I'm thinking that I don't want to do this. I don't want to have to.
Mm-hmm.
This is a lot more work than I anticipated. It isn't my dream practice or what have you. Now I'm backing out, so I can see somebody maybe being a little more detailed on the LOI.
I like that, because I like that, but there's no but. I like that. But
But
Phil and I will both say it's okay to find something that kills the deal. Kill it quick though, and don't just drag it out. You can make an offer based on this information. And I like that you bring this up, because the listeners are probably thinking exactly what you're saying, Paula. So I'm speaking right to the listeners, and I'm saying, look, the profitability and your ability to do the dentistry is all we need to feel good about making an offer. But if we get in and it's a shit show, to your point, yeah, we get out. But we got to get out quick so that we don't drag the seller through the mud. And I think that's what I don't know, Phil, I'd like for you to jump in, but
fast no's are better than long no's, right? And if there is a discovery, a moment where you can get out quick, absolutely. Time is money. And we're seeing this now on every practice that we have. We come out with a new listing, a new opportunity. And that first month, that opportunity is hot. And if we get it under contract in that first 30 to 45 days, and it sits on the sidelines for another 30 to 45 days because we're in this due diligence phase, and then now it's been 3 or 4 months and it comes back, we lose value, we lose time, we lose a lot of things that the seller was banking on that, maybe fault of my own, maybe fault of buyer, maybe whatever. But that faster no within those first 30 to 45 days is super important.
I think that's
okay. So you're saying, obviously you're going to say this because we're on a podcast, but you're saying truly, if I signed an LOI, I came in as a buyer, kind of first day I walk in, I look through a few things and I'm like, you know what? I'm just not getting that gut feeling. You'd be pretty okay with that. If I kind of did it fast. If I drug it out, that's where it gets frustrating. Right. It's like I drag out the LOI, I drag out the due diligence. Then I'm like, nah.
Yeah.
That's where the frustration comes in.
And you're absolutely right. And Michael and I and Paula, we've had the chance to work on a lot of deals. We've had the chance to work on deals in hot markets. And we know that the individuals and the questions that they ask and the delivery of how they proceed to do the transaction, we know where it's going to go, right? And we do our best to coach them up prior to making an offer. Because once we take that offer, we know they have to execute, right? And the same with the seller. I'm not going to take two offers and execute both of them and run the two trains parallel to one another. I'm just not going to do that. It's not fair to you. It's not fair to the seller. It's not fair to either of the buyers. So when we choose which train track we're going to ride, we got to make sure that we got as close to clear sailing as we can. And you're right, Paula. If we have to, if it's going to come off the tracks, get it off the tracks soon. And because most of that stuff, we want to have interviews with the seller. We want to have the go to the office meeting and poke at everything, make sure things work, and really dig in there right away. And a lot of the hesitation we have, though, is really from buyers to do that because they don't understand the financial information that they're getting well enough to say, I'm all in. And because I think we give them too much. And that's the one thing I think if we dial that back a little bit and go focus on the dentistry, then that they can absorb that. They understand that. The young buyer understands that. If I give a buyer a tax return from 2020 and ask them what the depreciation schedule is, they don't know. They don't have a clue, right? You and I know, but
we might have one that would.
Yeah. No, you're exactly right, Phil.
You have one that would know. Unfortunately,
well, ChatGPT knows everything. I'm right there. I think that's the key. Is like a quick no is okay. I've had buyers come back to me and say, well, I don't want to screw this up. I don't want to screw this up with Phil on a future deal. And I think that's wisdom, because if they're into a deal with you, Phil, and I'm the buyer rep and you're the seller's rep, and here we are, executed LOI, and we're 2 weeks into this due diligence process, they're like, I don't like this practice. I think that's okay if they got out quick, and they wouldn't screw that up with you, and they would, for good reasons, they're out, that you would still work with them on another deal. But I think if you did that over and over again, that might be a different story. But I do think that there's something to be said for the 2 tracks, and you're picking the right horse. I've had the one thing about Western that I feel like is a little unique about other brokers is you do give access to the seller fairly quickly. You do give the buyer more access than what a lot of brokers give on the front end. You guys actually won't accept an LOI unless the buyer's looked at the practice. You do give access to the sellers fairly quickly. In some cases, maybe they're even showing their own practice. That's not common. And so sometimes brokers, and we need to be careful because this program's not about Western practice sales, it's about all brokers. Sometimes they do withhold a lot of information. And so that's an interesting flavor to this topic as well.
Yeah, Mike, and Paula, you guys are great at this. And when we're seeing some hesitancy, right? I rather know why. I'm not going to fight you to say you should do it because of X, Y, Z. No, just tell me why and what you're seeing, and then I can address that for the next person, the next at bat, because the practice is going to sell. And it may not sell to you, Mike. It may not sell to Paula, but the next person up, I want to present it in a light that it does sell. And if I'm missing something and it comes up in our conversation, by all means, I'm putting it on the table, and it's the next man up, woman up is going to take a look at it.
Mm-hmm. Yeah, it reminds me of underwriting, right, Phil? Okay. Back in the day. If you submitted a deal that was sloppy and the underwriter found the problem, you're screwed. But if you put it all on the table and told the underwriter, hey, this is a problem and I've addressed this, the underwriter would be like, oh, okay.
That's many years ago, Mike. I don't like dealing with the underwriters, man.
You don't want to bring you don't want to dust those cobwebs off. But it is true. I think as a general theme, as we kind of put a bow on this thing is I think the buyers do need to hear what's wrong with the practice. I appreciate your energy comment, like let's build on the energy, but I do think that some buyers do need to hear what's ugly about the deal sometimes to make them run to close. And I don't know if that's at the LOI stage. I don't know if that's at the due diligence stage, but sometimes they need to talk to they need to talk through the ugly first. I guess that's the only other thing is Phil, at what point do you bring up that ugly? Is it in the prospectus? Is it on the call? Is it at the office when they're touring it? When do you discuss the ugly?
In every eye, it's different. In every eye, there is a different set of, what they're looking for is different than the next person up, right? So that comes in discovery of knowing the individual. And, the ugly could be a $10,000 a month lease. There's nothing I can do about that. I'll do my best to help, but that's pretty ugly, right? But the other one might be the guy's doing Invisalign. That's 20% of his production. To me, that's a good thing, but to Paula, it may not be because Invisalign scares them. They don't want to do the trays. I don't know the ugly either to that individual. Now, if you're telling me that hygiene is only 10% of collections, well, that's a conversation I'm going to have on the front end before they make an offer. That needs to be disclosed. That will be in my prospectus. That will be shown because that is evident, right? What does that mean then on the back end? Is the doctor, there's no new patients? Is he mining everything he's getting out of every single patient that he has? In the same token, if you got a practice that has 1,000 pro fees and it's only doing 600 in collections, that thing should be doing $1.2 million, $1.4 million. So the good, the bad, the ugly, it's the eye of the beholder, right?
I think that's so true. Well answered. Is if you threw all the ugly down on your prospectus, it might not be the smartest play because that could be a benefit to someone else. So touche. I think that puts you right in the broker's mind frame with this, because sometimes the buyers might be thinking that they're holding out, but the truth is they just don't know you very well. And so I think having conversations and working through that, any advice then, Phil, on what a buyer could do to get on your radar, to catch your attention, to tell you about them, to help that transition? What's the last little bit of feedback before we shut this thing down?
Absolutely, Mike and Paula. Thank you again for having me. It's been a pleasure. And the one thing I would tell you is our young buyers, we try to coach them to get in front of people like yourself, Mike and Paula. And if they can get in front of the next level, and next level is going to give them in touch with the bank, and they have these educated discussions on how to take the next step. We are finding we're spending a lot of our time educating on what is the process. We're getting a lot of buyers that just don't understand the process. They don't understand what they should be doing before they put in an offer. And I think getting those buyers referred back to you, and you managing them with your banking referrals and what have you, that's where they really need to start. That way they're educated coming in and they know how to swing the bat.
Yeah, I love that. Paula, last minute comments on this. Yeah,
I feel like I just kind of learned some things too, which was great.
Yeah, you're always interesting, Paula, because you bought one and you sold, and so you've been on both sides of the fence. And whenever our clients are kind of digging in on stuff that doesn't matter, I love when you pull out the seller perspective, and that's always invaluable. So thank you guys both for the time, the honesty, the directness. I think this is going to really help a lot of our clients, maybe buyers that are calling Western Practice Sales. You can send this episode just to help them get their heads straight before they go into that process, because I think it really can help them navigate this with more confidence, less scary. And, we all got a job to do, but I think I'll end it with this by saying, no one wants a bad transition. The practice broker definitely doesn't want a bad transition. The banks don't want a bad transition. The buyer rep most certainly doesn't want one. So if we can all figure out how to navigate with the least amount of risk, I think that's a win for everybody. So thank you guys both so much. Phil, I appreciate your time, brother.
Thank you, Phil.
Thank you guys.
Yeah. With that being said, let's shut it down on today's episode. Thanks again. Make sure you like, subscribe, follow Dental Unscripted, and we'll be publishing some more stuff later on next month. All right, talk to you soon, guys. Bye.
Thanks, guys.
Bye.
Thanks for listening. Let us know how you like the show. Rate us on Apple and Spotify. Subscribe and follow for more.